Hello, everyone, and welcome back. My wife and I were finishing up a support services review for our son who receives SSI and Medicaid, and it led me to thinking, I wonder how many people don't know the value Medicaid provides their adult special needs children. I know I didn't when we started on this part of my son's journey over 9 years ago. Medicaid was brand new to us. We didn't fully understand what Medicaid was, why it's important, and why we should even care about it. To be honest, I really didn't know the difference between Medicare and Medicaid. I heard those terms used interchangeably, so I thought they were interchangeable. And as you'll hear from Zeke's discussion in about 30 seconds, I was really wrong. I mentioned this to Zeke, and it got us thinking. We need to write about this because it is such an important topic. The world of Medicare and Medicaid can be confusing and often overlooked. Now, while I'm the finance guy of the family and my wife is the insurance lady, Medicaid was in both of our blind spots. It's a blind spot we had to address and want to help our audience do the same. In this video, Zeke and I create a quick summary of what Medicaid is, how it is different than Medicare, why it's important to know, and a brief summary to get you started. Hey, Zeke, kick us off and let our viewers know what is Medicaid and why it's important to learn about.
As Brian and I always say, being the parent of a special needs child forces us all to wear many hats, and there's always a lot to learn. And so while Brian and my main wheelhouse is finances and financial planning, we've also had to learn a lot about the world of Medicare and Medicaid benefits, both for the sake of our own families and for the families who we work with and talk to. In fact, before my oldest son was diagnosed on the autism spectrum at around 2.5 years old, I didn't know the first thing about special needs financial planning, let alone how government benefits worked or what the real value of them is. But boy, did I learn fast. And it started from talking with other parents and service providers and special needs support organizations. And it quickly became clear to me just how big of a role these programs played in providing supports and services for people with disabilities, young and old. And out of all the government benefit programs out there, the one that was most important was and is Medicaid. And so, like Brian said, even though the names sound so similar and they're often confused with each other, it's super important to know that Medicare and Medicaid are
Mhm.
not the same thing at all. So, to begin, Medicare is federal health insurance. It's a program that for the United States for people who are 65 years or older, or for other people with chronic conditions or younger people with disabilities. And there are lots of parts of Medicare. You've probably heard of Part A and Part B and Part C and Part D, and each one provides a different level of some type of health insurance. But simply put, that's what it is. Medicare is just medical insurance designed to provide assistance with temporary medical services. And that's it. So while it can provide all kinds of doctor visits and therapies and hospitalizations, it's designed for temporary medical care where a patient is expected to get better and eventually to return home. So Medicare is not for long-term care or long-term needs where a patient or a person is expected to need care for the rest of their life. So, for example, if you're somebody with Medicare and you fall and you break your hip, Medicare will pay for you to go to the hospital, they'll pay for you to get surgery, even to rehab at a rehab center until you're able to go home and be fully recovered and be at full strength. But on the other hand, Medicaid is a coordinated federal and state program, and it's designed to pay for long term or permanent medical expenses of elderly and low income and people with disabilities. And so that's why Medicaid is ideal for disabled people who need long term care and who are going to require long term support to function in their communities. And that's the reason why Brian's son has been on SSDI and Medicaid for the past 9 years. And so, even while his son is doing significantly better now than he did just a few years ago, he still struggles, as my son does too, with basic life skills and would have a very different and more difficult time living on his own in the outside world without these extra supports. And those supports that he receives through Medicaid really are invaluable because it's just not health insurance. There's so many other things. And I'm going to give you some examples of what Medicaid funds can be used for and to pay for essential support services for people with disabilities. So all kinds of housing supports and subsidies, day programs at an agency or an organization, training for the individual to be able to function and adapt in the community, assistive technology and home and vehicle modifications, camp, respite programs where trained staff come to home to stay with your loved one while you, the special needs parent, get a break, work training, supported employment, home and community-based services called HCBS waivers, self-directed service budgets, so much more. And the value of all of those programs and services can easily be over $100,000 a year in what they do and what they can provide. So you can do the math. That adds up to millions of dollars in total benefits over the lifetime of a person with a disability. That's a lot of money. It makes a world of difference in how you approach your long-term planning for your family, because every dollar of benefits that your child uses that are paid for this way is one less dollar that you need to pay for their care and their support out of your own pocket. What that lets you do is it lets you save more money and put your money to better uses in, or at least other uses, like, for example, planning and care for your non-disabled children, or thinking about your own retirement, those kinds of things. And the hard truth is that if the government doesn't cover the cost of care and your private insurance doesn't cover the cost of care, then that means that you're on the hook and your family is going to have to. And who among us really has a few $1 million just lying around to use for those purposes? This is why protecting an individual's Medicaid eligibility is so important when financial planning for the needs, the long-term care needs of your special needs loved one. That's why we use tools like ABLE accounts and special needs trusts and where they come in. They allow a person with a disability to have access to extra resources, money that would otherwise make them ineligible for those very essential Medicaid benefits. Trust us, Brian and I could talk about this all day, and there is a lot to learn. We cover this and so much more in this week's article. So click on the attached link in the description below. It'll provide you with the basic foundations that you need to know to begin your Medicaid journey today.
If you want to see our full article on what Medicaid is, why it's important, and how to get started, click on the link below in the description. Or if you also need some personal one-on-one help to jumpstart your financial journey, schedule a call with Zeke using a link provided at the bottom of this video. Zeke and I have figured out things that have been keeping you up at night with the knowledge, experience, products, and services that can help you avoid the pitfalls we've experienced in our journeys. Facing all this can get overwhelming. We know because we've been there. Most importantly, with us by your side, you're never alone on this journey. We're your resource, your confidant, your guide. And if you're struggling to sort out your financial situation, that's great. We're here for you. Last, but definitely not least, if you want to have more of these types of videos sent directly to your inbox, do the big three to keep our videos coming directly to you. Click on the subscribe button down below, give us a big thumbs up by clicking the like button, and share this video with your family and friends. Until next time, remember, we all deserve a better life, and we can help you take the financial actions needed to give yourself the peace of mind you need and set the protection your loved ones deserve.